What is the shot you spoke about on the radio for arthritis of the knee, and where can you get that shot? Okay, when you have arthritis of the knee, you have inflammation of the knee. The most common shot is with a steroid, prednisone. People, you hear the term cortisone. Nobody uses cortisone in joints anymore. There are much better products that can be used. So you can get a steroid shot, but they also have injections that are like artificial cushions. When you hear the term bone on bone, when you have the knee joint should have a space that's full of fluid so that when you move your knee, the bones don't rub on each other. Your thigh bone and your leg bone don't rub and create friction and create problems and pain. But when you lost that cushion of cartilage in the knee, now you have bone on bone, and so it's literally rubbing like sandpaper and making the surface of the bone raw, and it's very uncomfortable, very unpleasant, and hurts. So you can determine that by aspirating. You stick a needle in there, and if you get a clear fluid out, then you don't have that issue. If the fluid comes back with blood in it, that shows that you have inflammation and damage to the joint proper. There's also a chance that it could come back cloudy and with pus that can indicate a joint infection. That's unusual. The vast majority of the time, this is just arthritis and bone on bone. So you can actually get an injection. They put it in there and it puts an artificial cushion. So now instead of bone on bone, you got a space again. And that space gives you a cushion. The bones can't rub against each other. It usually takes 3 injections. The one of the product names is Cymvist, Cynvis, but there are at least 4 or 5 of them available now, different brands, but they all basically do the same thing. It's injected as a liquid. It turns into like if you were to melt wax and let it harden again, or if you were to take a liquid rubber and let it harden, you get a rubbery surface. But the bottom line is that it separates those surfaces, and it usually takes about 3 injections to give you the optimal benefit to get it every place that it needs to be. Now, how long will that last? It may last the rest of your life. You may be free of knee pain for the duration. It may last quite a few years. And if that is the case, then you've gone a few years without having to have knee surgery, usually a total knee replacement. So it can give you a buy, particularly if you do other things like start to get exercise and lose weight. If you need to lose weight, and everybody needs to lose weight, the less weight you have, the less pressure you have on that knee joint, because it is literally like a scale. So it will press down the more you weigh. And as you lose weight, it also lifts up and gives you a gap and less pressure. So less weight, less pressure. So no matter what your weight is, even if you had a decent weight, losing weight will help with that. And once you get to a certain point, it elevates up, and boom, all of a sudden you go from 10 plus pain on a scale of 10 to 0, because it usually doesn't ease down. You just get to a point where it elevates, and all of a sudden you go from maximum pain to no pain. So that cushion can help tremendously in doing so. So that's one of the things. Cymvist, Cynvis, or just Google injectable knee artificial cartilage or something like that, and it will lead you down the path with more information. Okay, great question.